Hi guys, welcome to my channel. My name is Rambo Lumabo and apologies for not able to create any contents for the last 4 weeks. It's because of the priorities that I have in life. I have a family to look after too. I've got a wife to look after too. I've got work to attend to, and also got friends who needs time, and also I've got faraway families back in the Philippines, and so I wasn't able to really put the time in this area, in the area of vlogging. So apologies. However, I'm officially back, and then I hope I could be able to sustain this to make more contents for you guys. And also, before we dive into our topic for today, let me welcome you to my channel here in Happy and Healthy Habits. So today we are about to talk about private health insurance. If you are like me, and if you are close to my situation, you might be thinking of additional cover for yourself and for your family. You might be thinking of taking up a private health insurance. Private health insurance is the additional insurance on top of the insurance that's been provided by the government. So generally here in Australia, the healthcare is free to everyone. If you are a citizen or if you are a permanent resident, generally if you get admitted to any public hospital, you won't be charged or you won't be paying for anything, not unless the service is not covered by Medicare. By the way, we call our health insurance, the public health insurance here in Australia, as Medicare, and it's all subsidized by the government. As I said, you won't pay any cents if you get admitted to any public hospital. However, if you are thinking of having an additional cover on top of the Medicare, on top of your government provided insurance, you might be thinking of having a private health insurance. However, the question now is it really essential? Is it really necessary to take up a private health insurance because we have a free healthcare? So this question has been there for a long time, and it's always very hard to answer this, if it's a yes or a no. So today we'll be dissecting the benefits of having a private health insurance and also its drawbacks, and also when to consider having a private health insurance. To start with, let's begin with the benefits of private health insurance. So having a private health insurance means to say that you could be able to skip the waiting list in the public sector. In public sector, there's a long waiting list for an elective treatment, for elective surgeries. For example, if you want to have a shoulder replacement, or if you want to have any kind of procedures that are not emergency, you need to wait for a certain period of time before it needs to be done. But if it's emergency, then going to a public health will gonna get you done straight away. So having a private health insurance will allow you to skip the waiting list if you want to have a treatment straight away for the problems that you have in life. For example, if you have a chronic illness just like diabetes, osteoarthritis. And number two, having a private health insurance means to say that you can choose your own doctor. Some people are very picky, some people are very specific about who cuts their belly, who fixes their bones. Can't really debate on those kind of people because they want to have more options. And for you to be able to do that, to be able to choose your own doctor, to choose your own surgeon who's going to perform surgery onto yourself, is a very big option for a lot of people. It's a very big thing for a lot of people, and that's also one of the benefits of private health insurance. And also, if you want to have a private room, then private health insurance is a good thing to go, because sometimes in the public sector, maybe it's not too bad here in Australia. If you are in the public system and you get admitted to a hospital, most of them you have about one or two two patients inside the big room, and you kind of still have your own privacy. And sometimes, subject to availability, you can have your own room as well, and you can enjoy the benefits of that. Also, if you have a private health insurance, you are avoiding the medical levy surcharge. Let me just tell you that most Australians, citizens and residents, pay about 2% on the Medicare levy. This one covers the subsidized free health care for everyone in Australia. But if you are earning about 90,000 as an individual, and also 180,000 for a family, if you are an income earner on that level, you need to pay a Medicare levy surcharge on top of the medical levy that you are already paying if you are an earner on that income bracket. And the medical levy surcharge is about 1 to 1.5% of your taxable income. So if you are on that income bracket, it might be a good idea. I'm not saying you need to take up one, but it might be a good idea to have a private health insurance. And also, if you have a private health insurance with extras cover on it, you could use the services such as visiting the dentist for your dental checkup, for your fillings, and also you can go to a chiropractor for muscles, and also for massage. You can visit physiotherapists as well, and that's also included in the hospital extras cover if you have a private health insurance. And the last but not the least is you can have a rebate from the government, or a money back, claiming money back from the government when you have a private health insurance, because private health insurance is also partly subsidized by the government. They give you a certain percentage to pay. However, there are also some drawbacks to private health insurance, and the most popular drawback is the cost. Private health insurance here in Australia is not cheap at all. It's not very expensive, but it is expensive. Generally, if you are paying premium every fortnight, you are giving away a few thousands of dollars every year if you don't really need a private health insurance. And also, having a private health insurance doesn't mean to say that you are exempted for paying out of the pocket expenses, because private health insurance only pays a portion and not the whole amount of treatment, but only a portion of it. Generally, when you have private health insurance, you still have to pay an excess. The higher the premium, the lesser the excess, but the lower the premium, the higher the excess that you will be paying if you want to use any services from your doctors or from any of your healthcare providers. Also, if you have private health insurance, that doesn't mean you are covered for all treatments or for all kind of services. depending on your policy, depending on the level of your cover, you are only entitled to take up certain treatments on those kind of covers, because different kind of level will offer you different kind of services. So for example, if you are bronze or silver or gold, these three have things that are included and that are not included in it. So if you decide to have a private health insurance, you really need to make sure it's personalized for you, because it varies from one level of care to the other. And even the most comprehensive healthcare insurances doesn't cover every single treatment that you would like to have. Also, some insurances have a very complex policy that you kind of don't know which one are you covered to. Thankfully, the government was able to implement a reform for those covered to be more specific, so that the people who use it will understand more and in a more specific manner. However, having said that, here in Australia, if you are 31 years old and you don't have a private health insurance, you could be hit by what we call the LHC, or the lifetime health cover. The lifetime health cover is an additional loading dose on top of the premium that the insurance is offering. And if you don't have any health insurance in place when you're 31 years old, you will be hit by 2% loading every year for 10 years time, and it can go until 70% loading for the premium if you decide to take up a health insurance down the track. However, don't feel guilty if you don't have private health insurance, because at the end of the day, it's not mandatory. And as I've said, here in Australia, healthcare is already free for everyone. But having said all of those things, I just want to share with you also when is it worth it to have a private health insurance. First one on the list is if you have a chronic illness, it might be a good idea to have a healthcare insurance, because if the chronic illness is bothering you every single day of your life and you want to get it treated and get rid of that illness, it's a good idea to have a private health insurance, because you could be able to skip the waiting list from the public system and have your procedure done straight away. And also, if you wanted to have a peace of mind, if you are that kind of person who wants to sleep well at night and have a peace of mind knowing that you are covered in your health, then healthcare insurance is also a good idea. It can make you sleep easier during the night knowing that you are covered for this health issues that could affect your body and your lifestyle as well. And also, if you are an elderly or if you are a senior, it's really a good idea to have one in place, because unfortunately, as you age, as we grow older, the more we are at risk developing certain kind of diseases that are not there when you are still young. So if you're elderly, it might be a good idea to have one in place. And also, if you are planning to get pregnant, although the healthcare here in Australia for delivering babies is very well looked after, it's one of the areas where the government really spends a lot of money to look after the newborn and also look after the woman who give birth. If you are a person who are specific about your obstetrician and the care that you can have. I think it's a good idea also to have a private health insurance. And also, if you have other issues in your body, just like for example, if you need your dental fillings to be done, or if you need physiotherapist, if you need chiropractor to really have that peace of mind when you are having troubles in your body, then it's a great idea, because using those services like dental, chiro and physio here in Australia could be very expensive if you don't have a private health insurance. And also it gives you access to ambulance, because generally here in Australia ambulance is not free, except in Queensland and in Tasmania, where ambulance is covered by the government. But if you're in other states, it is not free. However, you can have access to those kind of services if you have a private health insurance. Without private health insurance, if you call an ambulance here in Australia, you will be charged about $500. So the answer to the question, if it's really necessary or if it's really essential to have a private health insurance, is all dependent on someone's personal circumstances. You know, it all depends on where you are in your life at the moment and who do you want to protect, and also how much options do you want to have in your life. So it all end up to that person if he decides or she decides to have a private health insurance in his life. But if you ask me personally, in my status at the moment, because I have growing family, I've got 2 kids and a wife to look after too, and also myself, it is very beneficial to have a private health insurance, because I'm above 31 years old and I don't want to pay any loading dose down the track. So for me, it's beneficial and it's a benefit to have a private health insurance. And with the lifestyle that I'm living at the moment, it's really a good thing, because it gives me this peace of mind to really enjoy the life that I have at the moment. So that's it for me, guys. Thank you very much for watching and for tuning in to this channel. I hope you like it. If you do like it, please don't forget, subscribe to this channel, okay? Subscribe, and also hit the thumbs up. And you can also watch some other videos about health in this channel. Don't forget, happy and healthy habits. Love you guys. Bye-bye.